Hi, I'm Dr. Anthony Geroulis, a facial plastic cosmetic surgeon. I practice in Northfield, Illinois, and in downtown Chicago at the Neiman Marcus building. I'm going to talk to you for a moment about anesthesia in facial plastic surgery. There are three general modalities for this anesthesia to be achieved through. One is local, second is general anesthesia, and the third is twilight. Local anesthesia, you are awake. Needles are utilized to deliver Novocaine through your skin. As it goes in, you will feel it. A large volume of Novocaine, if you will, has to be injected to achieve good anesthesia, where you won't feel any surgery. The problems with it are the volume of anesthesia that has to be delivered will distort. If you think about it, if you have to put all that fluid in the face, the doctor will not have as accurate an idea of where the tissue is, because that fluid will still be in the tissue. The other problem is that if you should move in a surgery, that could be at the wrong moment for the doctor, and there could be a complication. The third reason is that with a local anesthetic, the time that it takes to get the operation performed is going to be longer. The length of that time will depend upon the surgeon and their quickness of surgery. But then again, I don't feel this kind of surgery should be rushed. But no matter what you call, and no matter how you put it, if it's done under a twilight or a general, it will be faster than local. Let's talk about the benefit of local. The benefit of local is really cost. So if that is a primary consideration, then you'll have to weigh it. And you'll have to weigh, is that cost really worth those other risks? The next is a general anesthetic. You all know that. A tube is in your throat and you are out cold. We can have brain surgery, chest, heart surgery, everything. So that's really extensive for facial cosmetic surgery. But people do it. What happens is the tube is in your throat. Think about it. Every time, you don't operate on a patient with their head out. Their head is turned. Well, when that tube is in its turn, it changes all of this tissue. The other problem is that under a general anesthetic, the muscles have no counter tension. They're not in a state of tenseness. They are totally relaxed. They're out cold. As a result, there's no counter tension. When the doctor pulls up here, the muscles don't give him any resistance. As a result, that's where I think a lot of these shocked, over-pulled, tight faces may come from. Also, general anesthesia is expensive, and general anesthesia carries risks and complications of death. Whereas local, that's very unusual to rare, and in twilight, that's very unusual to rare. Now, it is rare in general, but it can occur, and it will occur more there than the other modalities, in my opinion. Twilight anesthesia is what this doctor has practiced for over 30-some years. And what that is it's like a colonoscopy anesthesia for those of you who are 50 years old and over. What is that? Medications in your veins, and you fall asleep. A minimal amount of anesthesia of Novocaine has to be put in, but that's not put in for the anesthetic. It's put in to cut down the little bleeders. So as a result, the volume does not affect the surgery. Because you're not totally out, there's no problem, there's counter tension. But you will not remember anything and you will not feel anything. So you are essentially out or asleep, but your body is not. Your body is still awake. This is why I prefer twilight anesthesia. It is safe and it gives the patient a very comfortable approach, and it is cost effective. Thank you very much.